Most people think Medicare is free once they hit 65. Then they get their first bill and realize they've been planning retirement with completely wrong numbers. I'm going to walk you through the actual costs of Medicare after you retire, including the ones that catch people off guard. We'll break down what you'll really pay when those payments hit, and how to budget for expenses that aren't advertised anywhere on the Medicare website. Let's start with what Medicare actually is. It's not one program. It's broken into parts, and each part covers different things with different costs. Part A covers hospital stays. Part B covers doctor visits and outpatient care. Part D handles prescription drugs. Then there's Part C, also called Medicare Advantage, which is an alternative way to get your coverage through private insurers. Here's where it gets interesting. Most people assume Part A is completely free because they've paid Medicare taxes their whole working life. And for most people, that's true. If you or your spouse worked and paid Medicare taxes for at least 10 years, you won't pay a premium for Part A. But if you didn't hit that 10-year mark, you'll pay up to $506 per month for Part A coverage in 2024. That's over $6,000 a year for something you thought was free. Part B is different. Everyone pays for Part B, and the standard premium in 2024 is $174.70 per month. That's roughly $2,100 per year. But here's the catch. If you're a higher earner, you'll pay significantly more. Medicare uses something called Income-Related Monthly Adjustment Amounts, or IRMAA. This is based on your tax return from 2 years prior. So your 2024 Medicare premiums are based on your 2022 income. If you're single and your modified adjusted gross income was above $103,000, or married filing, jointly above $206,000, your Part B premium jumps. At the lowest IRMAA tier, you'll pay $244.60 per month instead of $174.70. Keep climbing the income ladder, and the top tier hits $594 per month for Part B alone. That's over $7,000 annually just for Part B. Now let's talk about something nobody mentions until you're already enrolled. The Part B deductible. Before Medicare pays anything for your doctor visits or outpatient care, you'll pay the first $240 out of pocket each year. After that, you typically pay 20% of the Medicare-approved amount for most services. And here's the scary part. There's no maximum out-of-pocket limit with Original Medicare. If you have a serious health issue requiring ongoing treatment, that 20% can add up fast. Part D covers prescriptions, and you'll pay a separate premium for this coverage. The average premium is around $55 per month, but it varies widely depending on the plan you choose and where you live. Some plans cost $10 per month, others run over $100. And yes, Part D also has IRMAA surcharges if you're a higher earner. Those range from an additional $12.90 to $81 per month on top of your plan premium. Each Part D plan also has its own deductible, copays, and coverage gaps. The deductible can be up to $545 in 2024. Then you'll have copays for each prescription that vary by drug tier. Generic drugs might cost you $5, while brand-name medications could run $100 or more per fill. So let's do some quick math. A single person with Part A at no cost, standard Part B at $174.70 monthly, and average Part D at $55 monthly is paying $229.70 per month, or about $2,756 per year. That's before the Part B deductible, before prescription copays, before the 20% coinsurance on medical services. For a couple, double that base cost to over $5,500 annually. But we're not done yet. Remember that gap in coverage I mentioned? Original Medicare doesn't cover everything. Dental care isn't covered. Vision isn't covered. Hearing aids aren't covered. And that 20% coinsurance with no cap is a massive risk. This is why most people buy supplemental insurance called Medigap. Medigap policies fill in the gaps. They cover things like that 20% coinsurance, copays, and deductibles. Medigap Plan G is one of the most popular options. It covers nearly everything except the Part B deductible. The cost varies dramatically by state, age, and insurance company, but expect to pay anywhere from $120 to $300 per month. Let's say $150 monthly, or $1,800 per year. Now our single retiree is paying Part B premium, Part D premium, and Medigap premium. Roughly $4,556 annually before any actual healthcare happens. A couple is looking at over $9,000 per year in premiums alone. Still with me? Because there's another option that completely changes this equation. Medicare Advantage plans, also known as Part C. These are offered by private insurance companies approved by Medicare. They cover everything original Medicare covers, plus they often include prescription drug coverage, and many throw in dental, vision, and hearing benefits. The kicker? Many Medicare Advantage plans have $0 monthly premiums beyond what you're already paying for Part B. You'll see ads screaming about $0 plans with grocery benefits and gym memberships. Sounds amazing, right? Hold on. Medicare Advantage plans work differently. They typically use networks, meaning you need to see specific doctors and use specific hospitals. Go out of network, and you might pay significantly more or get no coverage at all. These plans also use prior authorizations for many services. Your doctor recommends an MRI. The insurance company has to approve it first. Medicare Advantage plans have maximum out-of-pocket limits, which original Medicare doesn't. That sounds good until you realize the limit can be $8,850 or higher. If you have a major health event, you could hit that maximum. With Medigap, you'd have far less out-of-pocket exposure for the same situation. Here's what nobody tells you. Choosing between original Medicare with Medigap versus Medicare Advantage isn't about which costs less on paper. It's about predicting your health needs, understanding your risk tolerance, and knowing whether you value network flexibility or extra benefits like dental coverage. Let's talk about a hidden cost that blindsides people: late enrollment penalties. If you don't sign up for Part B when you're first eligible, you'll pay a penalty for as long as you have Medicare. The penalty is 10% of the premium for each full 12-month period you were eligible but didn't enroll. Wait 3 years? That's a permanent 30% increase on your Part B premium. For someone paying the standard $174.70, that's an extra $52.41 every single month forever. Part D has a similar penalty. If you go 63 days or more without prescription coverage after you're eligible, you'll pay an extra 1% of the national base premium for each month you were late. That penalty also lasts as long as you have Part D coverage. The exceptions: if you're still working and have creditable coverage through your employer, you can delay Medicare enrollment without penalties. But the moment that job ends or that coverage stops, you've got a limited window to enroll. Miss it, and those penalties kick in. There's another scenario that catches people off guard. Let's say you retire at 63, 2 years before Medicare eligibility. You'll need to bridge that gap somehow. COBRA might be an option, but it's expensive since you're paying the full premium your employer used to subsidize. Marketplace plans are another route, though premiums vary based on income and location. Some people are shocked to find they're paying $800 or more per month for individual coverage during those gap years. Now here's where things get really interesting. Those IRMA surcharges I mentioned earlier, they can be appealed. If you had a life-changing event like retirement, marriage, divorce, or loss of income-producing property, you can request a reconsideration. Social Security will review your case and potentially base your IRMA on your current income rather than 2-year-old tax returns. Most people never file these appeals because they don't know they exist. Another cost people underestimate: Medicare doesn't cover long-term care. If you need extended help with daily activities like bathing, dressing, or eating, Medicare won't pay for that custodial care. Nursing home costs average over $100,000 per year. Even in-home care runs $30 to $50 per hour in many areas. This is where long-term care insurance or significant personal savings become critical, but that's an entirely separate planning conversation. What about those people who claim they're paying almost nothing for healthcare in retirement? They usually fall into specific categories. Low-income retirees might qualify for both Medicare and Medicaid, which covers most costs. Some worked for employers with generous retiree health benefits that supplement Medicare. Others stayed healthy and lucky, avoiding major medical expenses while benefiting from zero-premium Medicare Advantage plans. But banking on luck isn't a strategy. Here's what you need to understand about projecting your actual Medicare costs. Start with the baseline: Part B premium, Part D premium, and either Medigap premium or Medicare Advantage out-of-pocket exposure. Add IRMA surcharges if your income warrants them. Factor in deductibles, copays, and coinsurance. Don't forget dental, vision, and hearing expenses, since Medicare won't cover those. For a healthy couple with moderate income, budgeting $8,000 to $12,000 annually for all Medicare-related expenses is reasonable. Higher earners facing IRMA surcharges might budget $15,000 to $20,000. People with chronic conditions requiring ongoing treatment should budget even more. The real challenge: these costs increase over time. Medicare premiums typically rise each year. Prescription costs climb. As you age, you'll likely need more medical care, not less. This brings us to a critical question most people ask too late. How do you actually choose between all these options? The decision between original Medicare with a Medigap plan versus Medicare Advantage isn't one size fits all, and getting it wrong can cost you thousands. Let's break down how to actually make this choice based on your specific situation. If you travel frequently or split time between multiple states, original Medicare with Medigap gives you nationwide coverage. You can see any doctor who accepts Medicare without network restrictions. Medicare Advantage plans typically have regional networks, so if you're in Florida for winter and need care, you might face out-of-network costs or coverage gaps. Snowbirds often discover this problem the hard way. Your health status matters enormously. If you're healthy and rarely need medical care, a zero-premium Medicare Advantage plan with modest copays might save you money compared to paying monthly Medigap premiums. But if you have chronic conditions requiring frequent specialist visits, the unlimited copays under Medicare Advantage add up fast. Original Medicare with Medigap Plan G means you pay one predictable premium and essentially nothing else except your Part B deductible. Here's something most people overlook: switching costs. You can change Medicare Advantage plans annually during open enrollment without health underwriting. But if you start with Medicare Advantage and later want to switch to Medigap, insurance companies in most states can deny you coverage or charge higher premiums based on your health. That window of guaranteed issue Medigap coverage when you first enroll in Medicare, that's usually your only shot at getting coverage regardless of pre-existing conditions. This creates a strategic dilemma. Some people choose Medicare Advantage to save money early in retirement when they're healthier, knowing they might face higher costs later. Others pay more upfront for Medigap because they want predictable costs and don't want to risk being locked out of better coverage down the road. Your prescription needs also drive this decision. Compare the drug formularies carefully. A Medicare Advantage plan might look attractive until you realize your specific medications aren't covered or require prior authorization. Standalone Part D plans paired with original Medicare offer more flexibility to switch plans if your drug needs change. Let's talk about what happens when your circumstances shift mid-retirement. Say you chose a Medicare Advantage HMO to save money. but then you're diagnosed with a condition requiring specialized care at a facility outside your network. You're stuck with that plan until the next enrollment period, potentially paying full freight for out-of-network care or delaying treatment. Original Medicare with Medigap lets you pivot immediately to any provider accepting Medicare. Income fluctuations matter too. If you're doing Roth conversions or selling property that temporarily spikes your income, those IRMAA surcharges hit 2 years later. But remember, you can appeal based on life-changing events. The key is understanding what qualifies. Normal retirement counts, moving from full-time to part-time work counts. Investment gains or routine withdrawals from retirement accounts. Those don't count as life-changing events. Dental, vision, and hearing coverage deserves its own consideration. Some Medicare Advantage plans include these benefits, which sounds great until you read the fine print. Coverage is often limited to basic services with low annual maximums, maybe $1,000 for dental. If you need extensive work like implants or crowns, you're paying most of it yourself anyway. Standalone dental insurance, or paying out of pocket, might actually cost less than choosing a higher premium Medicare Advantage plan just for minimal dental benefits. What about those Medicare Advantage plans advertising grocery benefits, gym memberships, and over-the-counter allowances? These perks look appealing in commercials, but rarely offset the potential medical costs. A $900 annual grocery allowance means nothing if you hit your out-of-pocket maximum of $7,000 because you needed surgery. Evaluate plans based on core medical coverage first. Consider extras as minor bonuses. Coordination with employer coverage creates another layer of complexity. If you're still working past 65 and your employer has fewer than 20 employees, Medicare becomes primary and your employer plans secondary. With larger employers, your workplace coverage remains primary. Understand which pays first because it affects your claims and out-of-pocket costs. Some people delay Medicare Part B enrollment while working, then face penalties because they misunderstood the rules around employer size. Medicare costs in retirement are predictable once you know what to look for, but most people don't figure this out until they're already locked into decisions that cost them thousands. The difference between budgeting $5,000 and $15,000 annually comes down to understanding these parts, knowing which penalties to avoid, and choosing coverage that matches your actual health needs rather than what sounds good in an advertisement. Run the numbers for your specific situation. Factor in your income for IRMAA calculations, your prescription costs, whether you travel, and how much risk you're willing to take with out-of-pocket maximums. The cheapest option on paper isn't always the cheapest when you actually need care. And here's what matters most. You can't fix most Medicare mistakes after the fact. Choose wrong during your initial enrollment, and you might pay higher premiums or face coverage gaps for the rest of your retirement. Get it right from the start, and healthcare costs become one less thing to worry about when you're supposed to be enjoying the years you worked so hard to reach.